Okay, let's get started. So today, this is part 3 of the Solink NSF joint webinar series regarding COVID-19 and its impact to the business world. Today, we're going to be looking at how, with phase 2 approaching, we'll be looking at how we can safely transition into the new normal. I'm going to give a moment for everybody to introduce themselves, and we'll start with Dr. Jeff Farber.
Good morning, good afternoon, everyone. I'm Professor Jeff Farber. I'm adjunct professor at Department of Food Science at the University of Guelph. I was formerly a director of food safety for Health Canada, and I was also director of the Research Institute at the University of Guelph, and have over 35 years of experience in the food safety area. Thank you.
And Jackie, we can go with you. Can you introduce yourself?
Hello, yes, good morning, good afternoon, everybody. My name is Jackie Healing. I'm the Director of Consulting and Technical Services at the NSF offices in Oxford in the UK. My background is primarily in supply chain technical support. I've been a technical director for a number of supermarket retail businesses around the world, and I've some experience in dealing with pandemics globally in my role working for those two businesses. I now look after a whole raft of clients with all their food safety, health and safety, fire safety type advisory services and training within the NSF offices.
Excellent. And Paul.
Thank you, Tom. I'm Paul Medeiros with NSF International, based in Guelph, Ontario, Canada, responsible for consulting technical services in North America. Hope everyone out there remains safe and healthy. It's a pleasure to be back on the panel with my esteemed colleagues. We continue to learn so much as we work to support an ever-broadening client base with their COVID-19 reopening efforts. And I look forward to sharing some insight with you all today.
Thank you, Paul. And last but not least, Matthew.
Hi, everyone. I'm Matthew Taylor. I'm the head of consulting at NSF in the UK. And I've been with the business approaching 20 years now. My background is environmental health, public health, extensive work in food safety with numerous retail and sort of commercial clients over the years. And quite recently, there's been a hell of a lot going on in the world of COVID-19. So interesting times. Thanks.
Couldn't agree more with you. Very interesting times. And we're going to be hoping to go over what the current state of things is, maybe debunking or going over some of the current claims that are being made surrounding COVID-19. I think that's also very important. And then we're going to talk a little bit as well about reopening practices. So now that we're entering, and we're seeing this not only here in North America, but around the world, we're entering into what most are referring into the next phase of social isolation or quarantine, phase 2. So we'll talk a little bit about what does that look like for business owners and some of the best practices as well. So I think to get started, the best kind of question is, and I think I'm going to start by asking Dr. Jeff Farber here. I'm going to ask, what is this current state of the crisis? Since we last spoke, what is the current state of the crisis? And if you could provide some updates regarding what we're seeing with COVID-19.
Sure, thank you very much, Tom. What I'd like to do is just cover off maybe a little bit of the science right now. And as Tom said, give an update in terms of some of the numbers, what we're seeing. So firstly, I just wanted to start it off looking at, and as you can see in this slide here, this showing the reproductive number for various viruses. So one measure of virus spread that we use is, you can see there the RO, or the reproductive number, which is the expected number of secondary infectious cases that is produced by a primary infectious case. As you can see with COVID-19, basically here, it's basically a number of about 2 to 4, the range. And influenza virus, by comparison, would be about 1.4 to 1.7. So the higher the RO number, the more contagious the virus. So if you have an RO number that is less than 1, that means that sustained transmission is really unlikely. So unfortunately, until the vaccine comes, the countries will need to make use of some combination of what we've talked about: social distancing, masks, washing hands very well, to try to bring this pandemic under control.
Jeff, just a quick question on that, because I have been seeing some news coming out just on all the social medias and some of the news sites as well, regarding some confusion almost on the rate of infection or the spread, right? I thought the other day there was a couple of things that I read where there was a bit of a discrepancy between what the WHO was saying and what the CDC was saying, and that we
Right.
like, is this as bad as we initially thought, or is it, you know, when in those opening stages where it seemed like a very, very large panic because it spread so easily, so effectively? Is that still the case?
Right, you're right, Tom. So basically, WHO came out, and one of their main folks said that asymptomatic transmission is not as much of a concern as they thought. They thought it was very, very unlikely. This was criticized by a number of scientists, because we have seen evidence of asymptomatic transmission to people. And WHO after that came out with a statement saying, well, they were sort of misinterpreted. So I still think that, you know, even though they've come out with this, they've sort of retracted that. And, you know, it's definitely serious. We've seen a number of cases increasing really globally in the world. So I think we still need to really pay attention to everything that public health folks are telling us in terms of physical distancing. There was another paper that just came out a couple of days ago on the use of masks, showing that face masks used by the public could make a major contribution to reducing the impact of the COVID-19 pandemic. So we still need to do those things. It's still a major issue globally.
Absolutely. Thank you very much for that.
So next slide, please. I'll just go very quickly. I know a lot of you have already seen this, but if we're looking at, for example, just focusing in here on the UK, the US, and Canada, and this is in terms of deaths per 100,000 population. So we have the UK in #1 spot there, US in #5, and Canada in #6 in terms of deaths per 100,000 population. So definitely still major issues in a number of countries. We go to the next slide. In Canada, for the most part, it's been mainly 3 provinces. So Quebec here, as you can see that here on the top here, about 53,000 cases. Ontario, #2 with about 31,000, and Alberta with about 7,300 cases. The rest of the provinces, fairly low numbers, but still driving the major centers, major urban centers such as Toronto, still driving the numbers in, for example, in Ontario. Definitely still an issue, although the numbers have been coming down within the last week, and things are starting to open up in both provinces. Next slide, please. I'm sure many of you are familiar with the situation in the US, and as back to your question, Tom, still a major issue, and there are a number of states in the US we're still seeing over 1,000 cases per day. So for example, states like California, Texas, Florida, Michigan, Arizona, North Carolina, still over 1,000 cases per day. So definitely still a major issue in some of these states. We know that obviously there are differences between the states. The case counts are rising in about 25 states, and as I mentioned, upward trend in a number of states in the US. So that leads me into sort of the next slide before we move on to another area. So here I just tried to put together for you sort of in one slide. We always teach our students basically there's no such thing as zero risk. And as we move ahead, as things opening, it's going to be what is the risk tolerance of people to certain situations. We're going to have some tolerance of risk as things as we go on to get to restaurants and patios. So, for example, on the right-hand side, where these are the things we want to do to approach that potential of zero risk. Again, all the things we've been talking about, limiting travel, washing your hands often, physical distancing, wearing a face mask as much as you can, infrequent touching of your face, gathering outdoors instead of indoors, keep yourself to the small groups, disinfecting surfaces are all things we need to do now and need to continue to do into potentially approaching the fall and winter seasons.
Excellent. And Jackie, maybe if you can provide us with a current, like an update, you being in the UK, based in the UK, kind of what is the current state of things across the pond, as they say in the UK?
Well, yes, we've moved on a fair bit from when we last spoke. We're now opening up businesses. Quite a number of non-essential businesses have been allowed to open, and then many more will open next week. Some school classrooms have gone back, although only really 2 of the primary, what we call the primary school, the first school years have been encouraged to go back with social distancing in place. And the latest news on that is we don't really expect schools to resume with any kind of consistency before September now. They had hoped to get everybody back to some schooling before the summer recess, but that's been recognised as really not possible. In July, 4th, 14th of July, 11th of July, those sorts of dates have been bandied around now for hospitality to start to reopen. And again, like yourselves with the patio, they're talking about, we have pubs in this country, for those of you who've never been to the UK, and they're a key part of our culture, so everyone's very keen that they open up. But it's likely really only to be possible for those that have got large amounts of outdoor space and a reasonable amount of indoor space. Many of the facilities are in very old buildings, so that's proving to be a bit of a challenge. But we're trying to open up as much as we can. Hairdressers are still shut, nail bar spas are still shut, hotels are still shut other than for essential workers. But I think people generally are of the view that, they might be able to get a summer vacation somewhere in the UK, somewhere towards the end of July or August. And I think everybody's really trying to work towards that. But it's still 2 metre social distancing. It's still no mixing of households. It's still meeting with other people only in open spaces. It's still only delivery or takeaway from any restaurants, and likely to stay like that for a few more weeks yet.
Absolutely. Paul, from a North American perspective, I know there's been a lot of news lately. We've seen a lot of things on the news where there have been large gatherings out in the open in North America, across the world for that matter. I did see it in the UK as well. I'd like to know we are seeing a push or transition into phase 2, as I mentioned at the beginning. Can you walk me through a little bit about what's going on in North America? Current state of things, how are we looking?
Well, it's a hodgepodge, right? There are hotspots, as Dr. Farber mentioned. So we see some parts of North America reopening. We see within states or within provinces, certain parts are reopening, but certain parts are not. It's introducing some risk because, using Toronto as an example, Toronto is still a hotspot, but then in Northern Ontario, it's not. Very low rates of community spread. But the concern is, well, what if folks from those hotspots start to travel out and they bring infection with them into the smaller communities? That's also, we're seeing that throughout the US. So there is that concern, even in some regions, the local residents are saying, hey, I don't care. You're not from this state. I don't want you here. That's sort of, bumper stickers, stay out.
Go home.
So we're seeing a little bit of that. I also want to say we're starting to see some collateral damage. We talk about, sure, the number of cases, how accurate are those numbers, the number of deaths. I mean, any death is too many. But even the non-COVID cases, because things like hospital surgeries for cancer patients or other patients are being delayed in some cases. Now that's creating some other, collateral damage that's very serious as a result of the focus on COVID-19. So we really cannot ignore the collateral damage beyond just the number of cases. So we see proximity continues to be the highest risk factor. So when I talk about reopening, we see the indoor crowded areas, right? Like, potentially stadiums, bars, even maybe museums, cultural institutions. Those are going to be among the last to reopen. We also see companies now starting to clamor to get external verification or certification to tell their customers, hey, we're safe, we're safe. We're starting to see some signs appear on doors. I would caution consumers that not all signs are created equally. So if you do, I would say a consumer should push. If you see something on the door of the local restaurant or car dealership or whatever that says, hey, we're safe, if you don't think they're safe, push and ask for it. Some practical items that have surfaced. We know that with the CDC, they've downgraded the risk of outdoor transmission. So even from a cleaning and disinfection perspective, we're now understanding that because of the way the virus works, you don't need Herculean efforts outdoors, which is part of the reason why outdoor patios work.
Yeah, and I wanted to just quickly touch on that, and this is going to be something for all of you to provide some insight on. I feel like in the beginning, when I was reading about COVID and everything that was coming out, it was do not go outdoors, do not gather together in large groups in any way, shape, or form. And now suddenly we've seen, these massive protests that took place all over the world, right? And justified protests. However, shortly after the protests, most countries kind of changed the tune regarding outdoor gatherings, large outdoor gatherings. It said, this is, it's okay. It's better to be outdoors than indoors. So that kind of threw me for a loop where I just didn't understand how that shift could happen. Why is it now suddenly okay to gather in large groups outdoors? So maybe, and Jeff, maybe you could provide some of the science behind the difference between being outdoors and indoors and the spread of the virus.
I mean, the thing is, Tom, like indoors, as we've seen, for example, you may have seen that outbreak that occurred in a restaurant in China, where you had one case, an index case, that sat at a middle table. And basically, he infected 9 other people. And there were 2 sort of tables on either side of the table that he was sitting in the middle. And it is unknown exactly if he was sneezing or coughing. But basically, it was in an enclosed room. And there was an air conditioning unit which was blowing over the 3 tables, basically. And so you have this area where you have droplets that are forming. They have no place to go. They're entrapped in a small enclosed space, as opposed to being outdoors where you have free air circulating, in a much, much wider space. So the virus doesn't have as much opportunity to connect between people. And so I think this is the major thing in terms of being outdoors, where the virus doesn't have that ability to get in contact with another person as readily as you would in an indoor environment. And we're still learning, Tom, about some of the, the way that the virus transmits in various spaces. The other thing is, as in terms of coughing, there's, they say you can have thousands of, viruses being transmitted in a heavy cough, and even in, heavy talking, if you're talking loud. So again, if you're in this enclosed space, you have these droplets that can easily get within this small confined area and infect other people, as opposed to being in a broad open space.
Absolutely. So I appreciate that. I know that I've been hearing a lot of questions regarding, why that is, and a lot of kind of uncertainty. And I think that is a great segue into my next question, which is just going to be a discussion around debunking some of the more common myths and things that we're seeing on social media. And I know, depending on what news station you're watching, you see a whole bunch of different things being said about COVID. So I'd like to spend some time doing that. Kelsey, if you could pull up the slides, and we'll start with Dr. Farber, if we can go through some of these slides and talk a little bit about some of the myths that are happening regarding COVID.
Thanks. I think before I start into some of the myths, I just wanted to bring up this, some of you may have seen this publication that came out, basically a survey in the US looking at cleaning and disinfection practices. And this is something we were always worried about. And in this particular case, they interviewed slightly over 500 adults. And basically what they found out is 39% of respondents actually reported engaging in non-recommended high-risk practices. And you can see here a large percentage, about 60%, had increased the frequency of home cleaning in their particular homes. So this is definitely a concern. And you can see here some of the high-risk practices, for example, washing fruits and vegetables as other food products with bleach. 19% of the folks did that. We are not recommending people do this for sure. Just washing your produce with cool running water is more than adequate. Using household cleaner to clean or disinfect hands or bare skin, about 18%. So you can see some of the high-risk practices, and the calls to poison centers have been increasing quite dramatically. So I think this is one of the sort of the unintended consequences of some folks coming up with some myths which they think can actually inactivate the virus, and has led to some very unsafe practices. But if we actually look, for example, in the next slide, this was some of the small Canadian survey. These are some of the beliefs by Canadians, some of the things that they actually believe in. And when you can see here, some of the things are quite remarkable in terms of exposure. And we've seen this exposure. Some people feel exposure to 5G wireless technology. So another myth in terms of, we've seen a lot about hydroxychloroquine. One of the interesting things that what they found is that in terms of these conspiracy theories, that it's people who spend a lot of time on social media platforms, basically looking at Twitter, Instagram, and TikTok, are most likely to believe in these conspiracy theories. So kind of interesting in that respect.
Well, I think, one of the things we discussed before coming on here, or something that I had brought up, was a video that had went viral across all the social medias. Since its kind of introduction and since it went viral, it has been removed from all social media sites. And it was something that I had seen spread by very reasonable, intelligent people. That's how well done it was. And that is the issue that we run into today, and why we're spending time talking about the myths and debunking some of the rumors, because, you know, these articles, these videos that are being produced nowadays are so well done that they can confuse and trick even the most intelligent people. And I'm not even going to name the video because I don't want anybody to watch it. It's not worth watching. It was a whole bunch of myth, very little fact, a lot of fiction. So that's why I do think this is important, and I do thank you for going over a couple of these now, and I think we've got some more to cover as well.
Just quickly then, Tom. Yeah, I mean, these are some of the things I put here, some statements that are true, and some of the, because it led to a number of myths and misbeliefs in terms of, you know, even things like, you know, if people think adding pepper to your soup can inactivate the virus. Definitely not true. One of the things I do want to say in terms of COVID-19 is not transmitted through houseflies, no evidence of that. Also, something that's come up is that some people are worried about mosquitoes, for example, transmitting the virus. Right now, we have no scientific evidence that that is the case, although we know there are some viruses that can be transmitted by mosquitoes, such as West Nile. But, you know, in terms of the virus, COVID-19 being in the blood, very, very rare even to start with. So the risk of coming down with that through mosquitoes is extremely low. We don't have the science on that. Some of the other things we know that it can be transmitted in areas with hot and humid climates. Just look at Brazil, number 2 in the world in terms of the number of cases. We've seen Arizona with over 1,000 cases per day now. One of the other things I wanted to point out is COVID-19 does not only affect old people, and this has come out recently in Canada. We have a city in Ontario, Hamilton, where we had 40% of the cases very recently that appeared in the age group between 20 and 30. So again, we've got to control some of these myths where people think it's only occurring in elderly people. We've tried to come out with statements, which right now there's been no food-associated cases of COVID-19 at all associated with food, or even for that matter, food packaging. So just some of the myths, Tom, that we're trying to battle with every day to come out with what the science tells us.
Yeah, and I think, and Matt, if you maybe want to chime in on kind of some of the myths you've seen and your thoughts on some of the kind of fact versus fiction that's going around right now.
Yeah, I think there's certainly more fiction out there at the moment. The one that I'd like to throw in is once you've had COVID-19, you won't get it again. And Jeff, you might be able to expand on this point, but as I understand, there is no evidence to suggest that you won't get it again, even if you've got the antibodies after having it a second time. So I think the World Health Organization is still looking into that one. So it'd be interesting to see what they discover.
Yeah, that's also been, Matthew, something that's been hotly debated even among scientists. As you know, with influenza, we have to get a shot every year because the virus is mutating. Every year we see a new version of the virus. With coronavirus, we don't have as much experience. We don't really know. They've been looking at what's the antibody response in people. How long are people going to be protected? Right now, there are various, depending on which immunologist you actually speak to, we definitely feel there definitely is some protection. And again, there's differences in protection between those people, it appears, between those people who have no symptoms at all and those people who are symptomatic. Even between those two groups, it appears that there may be differences in how they're protected. But definitely protection, from what it seems right now, I would say definitely protection for a season. I don't think we can go say much about that past a season, past a year. But again, we're learning, as you say, all the time.
Excellent. And Paul, I'll leave it to you. Just if we can keep it brief, I'd like to dedicate enough time to question 3. So if you do have any thoughts on the myth portion, feel free to chime in.
2 quick ones. Number 1, it still holds true. We've been saying it since January. Get your facts from reputable sources. CDC, WHO, trusted news sources. Number 2, the other myth that I've been seeing, and it's hard to top Dr. Farber's myths, but it's the myth of, hey, just get me through reopening and I'll be fine. That's a recipe for complacency, a recipe for disaster. Dr. Robert Dunn, the Detroit medical advisor, had a great statement. He said that it's only when community spread goes up that your program is working. In other words, establish a program, make sure it's robust, make sure you follow it every day, even when you think things are fine, because when the next wave hits, if you let it drop, then you're going to be contributing to the problem instead of helping.
Thank you for that. Okay, so now that we've kind of got a current state of things, we've gone over some myths, facts, fictions. I think now that we are making this approach, or coming up to this approach to phase 2, as they call it, which is reopening and lifting some of the restrictions, I'd like us to spend a little bit of time, and Jackie, we'll start with you. Maybe just some best practices, cleaning, auditing, where does the responsibility lie when a restaurant opens and we need to follow certain guidelines for that restaurant? Who's responsible for that? And this question, this is going to be for everybody. If we can all touch a little bit on this, I think actually we'll do Matthew, Paul, and Jackie for this question.
Who's going first? Me?
Jackie.
Okay. Right, so it's very clear, as the operator of the premises, you have the responsibility under health and safety regulation in the UK to make sure that premises is safe for both your crew and your customers. So what we're seeing is people starting to realise that. I think I saw some statistics this morning that said something like 60% of businesses haven't quite grappled and grasped that they are actually responsible for ensuring that they've done everything within their power to limit the spread. And we've been doing some work recently with a very significant fast food chain, international fast food chain, and they've adopted a philosophy which I think works quite well, which is that they take the view, or the model they used is they will set their restaurant up to be clean. I mean, in inverted commas, it's clean. So they'll check the crew in, and they put their processes in from the moment before the crew member, the staff member leaves home. So are you fit to come to work? Are you shielding? Have you got any reasons, mitigating reasons why you can't come to work? Are you coming to work in the right way, avoiding public transport? Don't wear your uniform to work? A whole raft of things. And then when they get into the work premises, they're temperature checked. And they go through a sanitation process, hand washing, and then they put on their uniform. And they do that for everybody coming into the restaurant to work. And that makes the restaurant a clean environment. And they then take the view that anything that penetrates that environment, flow of money, flow of people, delivery drivers, customers, auditors, whoever, are a risk of disease transmission, and they treat them as such. And so they effectively shield their crew, their staff and their facility from those incoming personnel and products and materials and packaging, whatever else is coming into their facility, as much as they can, through enhanced hygiene, through isolation of stock, through distancing, through turning certain individuals away if they don't think they're looking well enough to come in, and a whole raft of other practices. The hardest place at the moment for all of these facilities is their own kitchens. They're so tight, generally speaking, from a production point of view. They don't want space for cooking, they want space for selling. And so all the models back of house are very, very tight. And so there've been things like perspex screens, distancing on the floor, no face-to-face working, back-to-back, side-to-side, hand washing, full hand washing for everybody with every 20 minutes, all kinds of things. I mean, a whole raft, and every facility will be different. But that's the way we've seen businesses reopen. And I think we've seen the full spectrum from people who've got this really, really mastered with independent verification and all sorts of appropriate advertising and marketing, to those who really don't seem to know what they're doing. And I think it will become, even if it's not from a regulatory point of view, the license to operate, because consumers will hold you to account. They will see what good looks like, and they will avoid premises that are not implementing these practices properly. Is my expectation, and to some extent my experience so far.
I appreciate that, Jackie. Matthew, maybe if you can chime in a little bit on this.
Yeah, so I think further to Jackie's point, I mean, look, it's going to be great. We've got these controls that we can put into place, but don't forget about the employee. This is going to be a huge culture shock for some of these people, whether it's somebody pulling a pint or heading into the office. You've got to think about your training programs and how you get this message across. These controls are very different. They've got to get used to a new daily routine. And so have a think about, what can you do as an employer, as a business, to train these staff and get the message across, and think about the assessments that you could do just to sort of validate what they are doing. So whether that's an NSF assessment or your own self-assessment, you need to check their understanding. So I'd be wanting to ask my staff a lot of questions around what they're doing and monitor what they're doing. So, are you doing your temperature checks of your staff when they come into work? Just to check their understanding, really, because this is going to be a big shock for a lot of people out there, and they're going to be going back to work soon. So, yeah.
Absolutely. Thank you, Matthew. And Paul, you can kind of close out the question by providing some insights.
Sure. Well, a couple of practical ones. If employees are saying they can't wear the masks because their glasses fog up, well, you can get anti-fog for your glasses. So those exist. I mean, there is a solution to every problem that is out there. The other problem that we're seeing is full service restaurants, right? If you bring plates and customer cutlery back into the dish pit, you spray it off, you're releasing potentially the virus. So you go to, you can't do that. So you go to single-use items in the dining room. So those are some practical things. Maybe some broader things to consider is the concept of crawl, walk, run. We've seen locations reopen, and then we've seen them shut down right away. And in food service, shutting down after reopening could cost you the business because now you've reinvested in ingredients and food and everything else. So take a measured approach, right? So crawl, walk, run. Even if you're allowed to have 25, 50% capacity, start with 10%. Start with very small numbers, continue to learn, because the program that you reopen with and the protocols won't be the same ones you have in place a week later. You're gonna learn quickly what works and what doesn't work. Danny Meyer, the owner of Shake Shack, well-known restaurateur in New York, he said that, when it came to reopening, they threw all the pasta against the wall to see what would stick in terms of new ideas. But whatever sticks on day one, ain't gonna necessarily stick on week 2. So continue to keep your program alive, learn, adjust.
Absolutely. And I think you're right on that. I know personally a few restaurateurs who they are doing almost like a dry run where they in here in Ontario, we're approaching our phase 2 on Friday. Patios are open. So no one allowed inside, but patios are open. So they are inviting friends and family and regulars to do a dry run to see how this is going to play out. I think it's important because no one really knows what's going to happen, how it's all going to play out, how this is going to go. Your servers don't, you don't. So I think a big part of that as well is just constant vigilance, ensuring, go through, like you said, Paul, a very phased approach, almost like we're seeing with how we're going to get out of quarantine, a phased approach to opening back up your business. And I think also using your technology is going to be now more than ever very important, because it is not a question of the first night going in and saying, this is what we need to do with your employees. Keep in mind, the responsibility falls on ownership's shoulders. So it is important to consistently monitor your business, ensure that your employees are following the proper procedure. And it's something we do in training sessions in Solink all the time. We talk about operations. We talk about reviewing footage, your video footage, to ensure that your employees are doing what they should be doing when you're not there. Because it is your responsibility as an owner to ensure your employees are safe, to ensure your customers are safe, and to ensure your business remains open and continues to grow throughout these troubling times. So I implore you to leverage, it doesn't have to be Solink, but I implore you to leverage your security system. Those video cameras are 24/7, 365. They're always recording. You can always review footage to ensure that things are being done properly. And furthermore, if something does happen, review the footage to see exactly what it was that happened. And I think that is an important aspect as we enter into this reopening stage of COVID-19. I do want to give, it is about 10:41, so we do have some time left. I want to give an opportunity for anybody who's on the line right now to ask any questions that you currently have. You have us available. We'll open it up for the next about minute or two to see if we do get any questions. And while we wait for those questions, I'm going to go ahead and quickly share my screen. I do want to show you what I mean by auditing. Now, this is the Solink platform here. I'm going to click into my video page here. I just want to show you what I mean by auditing employee behavior. And I think it is important to look at various things. Now, I'm opening up a video camera here and I'm looking at what's going on in my business, because I'm not always going to be there. So I want to make sure that, is that 6 feet apart? I want to look at these things. I want to identify kind of what's happening in the business. And I might, pull up older video to look at what happened the previous night or the previous day. And I want to ensure that my staff is doing everything they can to ensure that we're not seeing, we're not seeing those proper protocols and procedures being broken. And one thing I really like is just monitoring every time somebody comes into the business. Because every time somebody walks into your business, there is a potential for breaking the guidelines. So we can use something like a motion search to quickly get to video to see every time somebody walks into the business, and then click forward again, and we'll see if anybody else is coming in at the same time. Are they following social distancing? These are these little things where we're really going to leverage video as much as we can to ensure that employees are following proper procedure. And we could use this same technology to see if we're cleaning tables off, to check what's going on in the kitchen. All sorts of these little things can be done using video. And everybody does have video cameras in their store, so I do want to make sure that everybody is going to leverage them as much as possible. What other, actually, well, I'm not seeing too many questions come in, but I am curious or interested in, we are going to be reopening. There is the question I have, and a lot of people that I've spoken to have very similar concerns. There is kind of some ambiguity in terms of guidelines and what do I do to reopen, right? We know we've got to open things up. We've got to order our food supplies and all that. That's great. But how do we prepare properly when we open back up? Do we put stickers on the floor? Do I go out and buy a bunch of plexiglass for any points of contact? How do I think one of the main questions I keep hearing is payment services, right? The card reader is going to be passed around quite a bit. What should I do with that? Do I clean it off every time? What should I use to clean it off? Paul, maybe.
Sure. Yeah. That we hear this from a lot of our clients. They say, guidelines. I'm swimming in guidelines. What I need is help operationalizing it, right? Because really saying, 6 foot distance, that's a platitude, right? Anybody can say it, but how do you operationalize it? My recommendation always is to do a very detailed walkthrough of your restaurant, of your, whatever it is that you're reopening. And you look for 2 things. You look for all your common touch points, regardless of what they are. And you don't do it alone as as maybe the owner or the operator. Bring in a team, socially distanced, obviously, of 3 or 4 people so you don't miss anything. And you look at all your, what we call proximity points, right? So what are points where people are going to be spending time together within the 6 feet? And you might have dozens and dozens of these. Then you look at each one and you say, okay, which ones really matter? Really? Because some of them, if it's an outdoor, thing that people are touching on occasion, probably not a big deal. But if it's something indoors, that's a common touch point, okay, that could be a big deal. And then you just plan around it. You can remove it, right? You can switch to hands-free. You can keep the door propped open, well, depending on health codes and other things. There are things you can do. Proximity points, okay, can we keep people separated? Great, well, if we can't, then let's look at shielding. So, I caution anybody about looking at any guidance that says here's specifically what you do and try to implement it in your establishment, because it might not fit. And then the second thing is, whatever you put in day 1, try it out, crawl, walk, run, and be prepared to keep on changing it. There's a store I go to on a weekly basis, grocery store, and I was so impressed because every week I would go in there and the controls were slightly different. They were learning. They were making it up as they went, but they were learning and they were improving, keeping their program alive. That's what they got to do.
Absolutely. We do have a couple questions that came in. One of the questions is, what are some of the ways to deal with new sanitary wipes and other supplies to help with quick cleaning of high touch point surfaces in food manufacturing environments? Jeff, I think you might be on mute.
I wasn't sure, Tom, what are some of the ways, wasn't that clear to me, but I'm thinking.
Some of the ways to deal with like new sanitary wipes and other supplies. So some of the new products, sanitary products that are hitting the shelves to help with quick cleaning of high touch surfaces in food manufacturing environments? Like, are there, you know, do you guys know of any sanitary wipes or other supplies that help in terms of cleaning quickly high touch areas and surfaces?
Yeah, I mean, firstly, there is each, I think, country, the public health have approved lists of disinfectants. So the EPA has one here in Canada, Health Canada has one. What they're also starting to do is, if you notice, is that they're also starting to look at some of the, for example, the alcohol disinfectants in the bottle. So I think it's very good. Health Canada recently, for example, has recalled about 10 different manufacturers of these products. So I think looking at some of the lists that are being put out by your local public health, provincial or federal, keeping track of what's been recalled and what's not, and going to some of those sites that list some of these approved disinfectants really is a way to go. But I do agree, it's, you know, it is tough for people to keep up with all these. But the general ones, like I don't know if I can mention brand names, but I mean Clorox and you know alcohol disinfectants that contain at least 70% alcohol. Some of the common ones that are being used are really the ones I think that to use most frequently. The other thing that's come up is, even in a household, how often do you have to change, you know, if you're taking out a disinfectant wipe? You know, we usually say, okay, if you're going to be using one, you can use maybe 4 or 5 different areas in your particular facilities before you throw it away and use another one. So that's another sort of tip that people have been following. But definitely interesting area and interesting question.
Now we do have a few more questions that came up here. In small facilities, it will almost be impossible to practice social distancing. For example, while packing manually a 50-pound bag, any suggestions on that scenario or scenario similar to that, where social distancing is very difficult because there's a lack of space?
I think it's very much about, think of this like a risk assessment. So if you can't eliminate the hazard, which is COVID-19, what else can you do to reduce that risk? So it could be PPE, it could be side-by-side working, or back-to-back working. So think about those kind of controls that you can put in to reduce that risk to its lowest possible level if you can't eliminate it. Because there will be cases where, you know, it's a small space to work in and you can't do anything about that, right? So think about those controls and reducing that risk would be my answer.
So for example, in meat plants, Tom, they put in plexiglass shields between each worker, and they're wearing PPE with a face mask and a glass shield. As you say, it's very difficult to not to have workers side by side, but you can use those things.
Actually, that's a quick expansion on that. So disposable masks and PPE, like protective equipment there, how long can disposable masks be worn for before you need to switch it out?
Okay, well, I mean, obviously there's different scenarios, Tom, in terms of, firstly, if you're talking about people in the public, basically, you know, if you're wearing one of the face masks that basically you should be using it for the day and then washing it, putting it into the washing machine and using a hot dryer. If you're going to be, I mean, it's very different in each scenario. In hospitals, of course, when they're going to a patient, it's a one use. After you've seen, you know, a patient, basically you're throwing out your masks. In the food industry as well, I think depends on the type of mask that they're using. I'm not sure, Paul, have you seen any guidelines on how often that they're actually, for how long in, for example, a meat plant?
Sure. I mean, the general rule of thumb is once a mask becomes wet, it's no longer as effective. So you replace it. In a food plant, you shouldn't be touching it anyway, but if it's soiled, you shouldn't be using it. The other risk, we're seeing more and more of this, recommendation is, you know, put it on, don't touch it, keep it on all day. because the act of donning and doffing your mask contaminates it and could contaminate you. So again, the other guidance is, infrequent removal of and putting on your mask. Again, recognizing that in those cases, often the use of the mask is to protect others more so than to protect you. And in cases of where you are using, an N95 or equivalent to protect yourself, as Jeff mentioned, depends on the setting, how often you need to use it or replace it. One thing that we've been finding with our clients is where originally we thought early on, well, you probably don't need an N95 mask given the type of environment you have. But in the case of a museum, for example, there's security, or there might be a need to administer first aid. Under those circumstances, you are going to want to have that tighter PPE to protect the security official or to protect somebody administering first aid. So our recommendation now has evolved to become, have a supply of those within your facility.
Yeah, the other thing, Tom, for general advice, it just came out, the WHO. If anyone wants to Google, it's just advice on the use of masks in the context of COVID-19. Interim guidance just came out June 5th, 2020. Everything is in there. It's very comprehensive.
And maybe we can, I think, do you, sorry, you said that there was a link for that? Do you have a link?
No,
or
if you just Google WHO advice on the use of masks in the context of COVID-19. Just came out June 5th, 2020. It's an excellent document.
Yeah, because there was a follow-up question to that one there, which was, in this example, it is a very humid plant where personnel are sweating, and the mask is likely to be wet quite quickly. So would the recommendation in that scenario be to change that mask more frequently?
Yeah, I think it would, as Paul said, it just loses its effectiveness as when the mask is wet. So it creates.
Absolutely.
It loses its effectiveness, and people start to touch it and mess around with it, and that's a problem in itself. So you have to accept that in some instances, masks might have to be changed every hour, every 2 hours. Certainly every time there's a break, leave the line, go to the washroom or anything like that, you've got to change the mask.
Absolutely. And just while we're on this topic, there is one additional question. If you guys can comment on the difference between face masks and face shields as it relates to, let's say, a food manufacturing plant. So the face shield being the one, the almost the plastic that comes down to cover the face, and the mask obviously covering your mouth.
Yeah, I mean, the trouble with the face mask, Tom, where I see it, if you're not wearing a face mask plus shield, is you have areas in between where the virus, if you have droplets, that the virus could get in. So that's a big difference. So if you're only going to wear one thing, I think, and again, depends on the setting, but if you're going to be using for consumers, using triple layer face masks is really with a very tight fit would be the most effective in terms of consumers. Then again, as Paul mentioned, it will differ depending on if you're in a hospital setting or an industry setting.
Absolutely. And we have 2 more questions and we have about 4 minutes left. So I want to make sure we answer all of these. So this one's coming from a agriculture operation. We have been working overtime since the pandemic started to develop and implement our COVID-19 action plan. At this point, what changes or considerations are being made for this from an auditing perspective? So I believe what that means is just in the sense of, how does auditing work into the COVID-19 action plan?
Well,
Do you want to have a go?
Yeah, I'd say when you look at outbreaks, especially the ones that I've been seeing and following in Ontario related to on-farm, it's with worker housing, right? Close confined, either packing houses where people are packed side by side, or migrant farm worker housing. Those are such high-risk hotspots. So from a risk perspective, please focus your attention there. In terms of auditing, a lot of the audits are food safety or quality management system based. A lot of clients have been asking for addendums to existing audits so that they can, especially if they're suppliers, right? So that they can assure that their suppliers are following COVID-19 best practices. For very much, as I've been seeing it, it's been just based on, those specifiers who are interested in COVID-19 controls among their supply chain that are asking for these addendums to be added in. And those addendums are very much based on what they as a specifier think their suppliers should be doing. I'm not aware of GFSI, or at this point, I could be wrong, implementing COVID-19 related specific measures. I'm not sure if Matt or Jack,
I mean, as an audit company, we've all been issued guidance, and we've been working on our own instructions and ways of working for our auditors to go back out into facilities. So all the checks you would expect before they leave home, and social distancing on arrival, and protective equipment and face masks and all of those sorts of things. In general, the scheme owners are starting to move towards a hybrid model of remote auditing, plus to minimize the amount of physical time that needs to be spent in a premises. So that seems to be the direction of travel, although there's a little way to go yet before that all gets through the relevant sign-off procedures and everything else. I think from a hospitality chain point of view, and I'm not sure I fully understood the question, so we'll try and come at it from a number of angles. We are not seeing we're seeing most clients who have in the past had their health and safety and food safety assessments of their operations, particularly hospitality operations, now expanding that scope to include their COVID controls. So the typical audits that we would have done in the past that would have been around food safety and fire safety, maybe health and safety, will now have a COVID element to them. So they're pretty much all getting expanded to include a COVID related element.
And I actually got, we have time for just one more. So this is actually a good point and something I wanted to make sure we covered. It's a follow-up. So, there was that original question where we talked about some of the ways to deal with new sanitary wipes and other supplies. And actually what the context surrounding that was from a waste management perspective. Because we're going to see such a high volume of these wipes and garbage as it relates to all of this stuff could be potentially infectious waste in a fast-moving, even a manufacturing environment or restaurant. What are the best practices in terms of dealing with that waste? How do we get rid of it? What's the disposal process like?
And personally, I think this is becoming quite an issue. I don't think the local, particularly even for household waste, we just haven't really, certainly in the UK, got on top of this terribly well. I mean, the best practice at the moment is still to double bag and dispose of it in your general waste. And if you can hold on to it for 72 hours and then dispose of it in your general waste. That's the guidance in the UK. Different, I think, states and jurisdictions and councils and everything will come up with different ways. But at the moment, there's no mass facility for handling this material as a clinical waste material.
Now, should it be tossed in a closed bin? We're going to see a lot of these wipes. There's going to be, every 2 minutes, we're going to be throwing wipes into a bin. Is best practice to keep that bin closed, let's say, or have a separate bin for it? Any cleaning supplies go into a separate dedicated bin?
Ideally, again, a bin where you have to touch it with your hand. Now you have created a common touch point, like a lid. So hands-free, hands-free with the lid.
The step one, the one with the step, right? Sounds good. We have one last question, then we're going to wrap it up. We're about a minute over time here, so I don't want to take up too much time. But any advice on fabric masks, the ones that people are making themselves? We're seeing people make it with sometimes 3, 4, sometimes even 5 layers, thinking that it's better. Is that actually the case? Is it better to have a 5-layered 5-layered cloth mask over a 3-layered cloth mask?
I think, Tom, nobody's really done the science on that. Definitely multi-layered is good. WHO is now recommending a 3-layer mask, which makes sense to me. But you got to take into account the breathability because you don't want to be gasping for air. So, in my mind, minimum double layer. I think triple layer is best.
Excellent. Thank you very much. So that rounds up all the questions. I appreciate everybody for not only joining, but the panelists for taking the time to answer those questions and going through this webinar. Also, I do want to point out that Kelsey has provided a link to the document that Dr. Jeff Farber was mentioning regarding masks. So that is in the chat there. You can copy and paste that and visit that on your own time. Again, thank you very much for joining. I want to wish everybody the best of luck in terms of reopening and transitioning back to a new normal. And again, thank you panelists for taking the time to be here. Everyone stay safe, and until next time.